Welcome guys, I'm Dr. Kelvin and this is my channel. Here we talk about things that help you stay healthier for longer. I'm a wellness consultant, so yes, it goes without saying that I am interested in your well-being. So you really need to be subscribed to my channel so that we can build this community together, you know what I'm saying? You're welcome anyway. In this video, we're going to talk about 2 reasons why diabetes is responsible for more amputations than any other disease conditions out there. Yes, diabetes is the leading cause of non-traumatic lower limb amputations. And this is very important, especially in the developing world where access to healthcare is a challenge in terms of financial cost, in terms of physical location of these health facilities. And so if you are diabetic, you really ought to be paying attention to your lower limbs because you could lose it. Diabetes is an inability of your body to metabolize sugar properly. The hormone insulin is either not being produced enough, that is type 1, or is being overproduced, but there are factors that are preventing it from functioning properly, that is type 2 diabetes. And type 2 diabetes is indeed the most common form of diabetes. Now, when you eat, your body breaks down your food into sugar primarily. This sugar enters the blood, and insulin is supposed to push the sugar out of the blood into the cells where the sugar is either stored or utilized to create energy. Unfortunately, if you are diabetic, sugar ends up staying in the blood. When the sugar levels in the blood rises to a high level, it begins to diffuse out of the blood into areas where you typically do not want sugar to be. Some of the key areas where sugar would go and be deposited eventually is under your skin. In the skin, we have nerve endings. These nerve endings carry sensations to the brain, which is interpreted to let you know what's happening in your lower limb. So as you step, you feel that you are stepping on a nail on the ground or whatever, and your body adjusts accordingly so that you don't get hurt. But when sugar is deposited under the skin, it kills off these nerves. The reason why your lower limb is more at risk is because you typically don't see what's happening down there. Same effect happens on your hands. Because you can see your hand, your eyes can compensate for whatever is going on, but on the lower limb you can't see it, and so injury to the lower limb tends to cause far more damage, which needs to be treated with amputation. So nerve damage is the first way in which diabetes typically leads to amputation. The second way is through atherosclerosis. Again, the high sugar causes injury to your arteries, and the body's attempt at healing these injuries results in a condition called atherosclerosis, where the blood vessel becomes hardened and is unable to carry as much blood as it would previously carry. And so the lower limbs are starved of blood, and so over time it begins to show in poor circulation of blood to the lower limbs, which can be a major source of pain, something called intermittent claudication. Now, if you have atherosclerosis in association with the nerve damage, the combination is very damaging to the lower limb, such that in the event of an injury as described previously, the progression is faster. And so all diabetics are advised to pay particular attention to their feet. Things that you would take for granted, such as clipping of your toenails, should be done professionally. And if there is any injury to the toenail or to the toe itself, should be taken more seriously than you would probably take it if you are non-diabetic. And if you have a diabetic in your family, this information is very critical. Diabetics are advised to wear open-toe shoes. They shouldn't wear closed shoes, because in the event that the shoe is too tight, they will not feel the pain and could actually end up with damage to their toes, which could eventually result in amputation. So number 1, examine the feet visually every single day. Avoid closed-toe shoes. Have a professional clip their nails, or a family member clip their nails, and in the event of any injury, report immediately to the hospital so that appropriate intervention can be started. So these 3 things could be life-saving. But above all, make sure you are consistent with your medication, because that's one way of keeping your blood sugar in check and avoiding all these complications that I'm speaking about. So a diabetic can live a full normal life if they stay consistent on their medication. Thank you very much. Hope this information has been of value to you. If it has been of value, number 1, subscribe. Number 2, share with your network, and let's build this community together. Have a fabulous time. Peace.